Ever since that first time I got death cramps in 9th grade science class, I've been sure that if I could just get a diagnosis, I could get relief. I dreamed of getting a diagnosis, of having that moment where it all made sense and somebody could explain my body to me. A diagnosis meant answers. A diagnosis meant someone would finally help me. A diagnosis meant there was hope. But I finally got my diagnosis, and it didn't go like I thought it would.
What's happening to your body, we don't know, because we've never really studied the female. Say it's all in my head, but the research is quite spotty. No, we've never really studied the female body. I go to the doctor to get dismissed. Try losing weight, you're just anxious. That's fine, that's cool, I'm not pissed. Just wait 10 years for a diagnosis. Psychosomatic, you're so dramatic. Hysterical, emotional, hormonal, erratic. Heart disease, chronic fatigue, depression and anxiety. Do you have pain? No, you don't, because we've never really studied the female body.
I'm Kate Downey, and this is Cramped, where I search for answers to questions about my period pain and then try to understand why those answers are so hard to find. When you have severe period pain, and you talk about it a lot, and you research it a lot, you inevitably have to consider endometriosis. Many fellow crampers that I know have eventually gotten an endometriosis diagnosis. So of course, I've asked my doctors, could I have endometriosis? The answer has always been,
probably not, because it didn't show up on the ultrasound.
Or
Probably not, because you don't have heavy bleeding.
Or
People with endo usually have pain all through their cycle.
But still, I wondered. And after talking to Dr. Tang back in episode 1, I was even more suspicious. Did I see a doctor? No, I read a book. It was called Beating Endo, and I learned that none of my previous doctor's reasons for ruling out endometriosis for me were legit. I looked up the author, Dr. Kerin Orbuch, and it turns out she is a practicing endometriosis specialist right here in LA. I decided to reach out and see if I could get an appointment, and the experience of setting up this appointment was different. I had to call and leave a message with my symptoms and why I wanted to see Dr. Orbuch, and if they thought I would be a good candidate, they'd call me back. After this audition to be a patient, I got a call back, and I was able to make an appointment for a consultation and an exam. Dr. Orbuch does not take insurance, and the out-of-pocket cost just for this appointment was going to be over $800. And listen, if I had not been making this podcast, if I had not promised you answers and a satisfying conclusion to the mystery of my period pain, I don't think I would have been able to make myself spend that money, especially considering I already pay over $400 a month for health insurance. But a promise is a promise. So after making the appointment, I was instructed to gather all of my previous medical records and imaging, fill out several questionnaires, and then send it all to their office so that it could be reviewed before my appointment. The actual appointment was very different than any appointment I've ever had. For starters, we actually had an hour to talk. Diagrams were drawn, videos were played. I was able to ask every question I had on my list, plus more that came up from our conversation. There was time for me to process and absorb what I was hearing, and time for me to come up with more questions. There was a physical exam where I was informed that my cervix has been pulled slightly to the right, probably from having more endometriosis lesions on the right and having scarring that's pulling my organs that way. I would say TMI, but I think we're well past that on this podcast. Dr. Orbuch agreed to be interviewed for the podcast, so you can hear directly from her some of the questions I asked during my appointment. It turns out it's not legal to record a doctor's appointment in this state, so I interviewed her separately. What is endometriosis?
Endometriosis is an all too common, devastating disease that roughly about 10% of those who are born with a uterus have. And its symptoms can cause gynecological symptoms, which could include painful periods. One can have pain all month long, ovulatory pain, which is mid-cycle pain. One can have pain preceding their menses, after their menses. They can have heavy bleeding. They can have pain with sex, either on entry or deeper penetration or both. And infertility is a huge component. Many also suffer from gut issues or GI manifestations, such as constipation or diarrhea and or constipation and diarrhea, bloating, painful bowel movements. Others can have urological symptoms such as urinary urgency, frequency, like, oh, I got to pee all the time. Constitutionally, those suffer from a lot of fatigue and exhaustion, increases the likelihood of autoimmune diseases.
So those are the symptoms, but what causes the symptoms?
What endometriosis is when you have cells that are similar to the uterine lining or endometrium-like cells. Those are the cells that every month are getting thicker and thicker and thicker, and then we withdraw bleed and get our period. So endometriosis is similar cells to the endometrium, but they're found external or outside of the uterus. So endo has been found in just about every organ of the body, believe it or not, even in brain and nose and heart and lung. But we often have this misunderstanding that it's just a menstrual disorder or a period disease. And you can see by all of those manifestations, it's really systemic, and it's an inflammatory disorder that wreaks havoc really on the body from head to toe. And what's so devastating is there's often a 10-year diagnostic delay from symptom onset to diagnosis. Sadly, I often see in my practice 20 years in, 30 years in.
What about endometriosis can cause your periods to be very painful?
These implants of endometriosis, which are endometrial-like cells that are external to the uterus. And what happens is month after month, they get stimulated by the hormones coming from the ovaries. And those implants of endo get deeper and deeper and deeper, and they start to distort the pelvic anatomy. So it's either pulling like the uterus, the ovary, the rectum, the bladder to the right side or to the left side, or pulled to the back. So there's like a pulling anatomical distortion that's causing pain, which is then by pulling on the underlying muscles and fascia. So that's one component of causing period pain. Secondarily, and what I think is actually more important, is the inflammatory effects. So what's happening from within every endometrial implant is that inflammatory mediators are being released. So they're called interleukins. They're basically setting off chain cascade of pain and pain mediators. It's causing extreme debilitating, like curl up in a ball, clench your tush, clench your muscles. I want to scream pain.
If you are lucky enough to get your diagnosis of endometriosis or suspected endometriosis, what happens next? What is the treatment?
The only way to make the diagnosis of endometriosis is surgery. So when a patient comes in my office, by listening to their history, I do a physical exam, I can tell with 90% likelihood whether someone has endo just by listening to them.
The kind of surgery that's used to diagnose and treat endometriosis is called laparoscopic surgery. They call it a minimally invasive surgery.
So instead of making a cut like a C-section scar, you're basically putting a camera in the belly button and anywhere between 2 to 4 tiny little incisions that are closed with medical crazy glue. They're 5 to 8 millimeters, very tiny. And we're putting instruments through those areas. I'm looking everywhere from the domes of the diaphragm, liver, gallbladder, appendix, large intestine, small intestines, and obviously, of course, uterus, ovary, rectum, pelvic side wall, bladder, looking inside the bladder.
Once she's got a camera and these instruments poked through holes into your belly, she's hunting for spots of endometriosis, or lesions. Apparently, there are a lot of different ways that lesions can visually look, so it's important that a specialist is the one looking. Sort of like how if you're hunting a very specific kind of animal that keeps attacking you, you want someone with you who has spent years and years of their life studying this particular animal. Someone who knows their behaviors and their tracks and what their poop looks like and can recognize every unusual sign of that animal. And not someone who read the Wikipedia page about this animal 4 years ago. When she finds lesions, she uses those instruments to excise the endometriosis.
So excision is, I use scissors and I'm literally cutting out the areas that I'm suspecting are endometriosis. I then send it off to the pathologist, the doc who looks at stuff under the microscope, and they say, oh yeah, these cells look very similar to the uterine lining cells or endometrial-like cells. And then we have the diagnosis of endometriosis. So I'm diagnosing it, and it's therapeutic because by excising or removing that implant, it's allowing for a restoration of the anatomy that was either pulled to the right or left or back, as well as a removal of those inflammatory mediators that are wreaking havoc head to toe systemically on the body.
I left that appointment at Dr. Orbuch's office with the information that I probably had endometriosis and possibly adenomyosis. Adenomyosis is endometriosis's nasty sister. Like endo, it involves cells similar to the ones in your uterine lining being somewhere they're not supposed to be. But in the case of adenomyosis, those cells are inside the muscle of the uterus. This causes the uterus to be bigger than usual and usually causes very painful cramps. Dr. Orbuch was 90% certain that I had endometriosis and possibly adenomyosis, even without having done the laparoscopic surgery. So it's not an official in-the-charts diagnosis, but it's good enough for me right now. So there it was. After 22 years of unexplained pain, of shrugging doctors and normal ultrasounds and over-the-counter painkillers and dead ends and medical limbo, a diagnosis, an explanation. But when I left the appointment, I didn't feel the way I thought I'd feel. I started just talking into my phone to try to figure out what I was feeling. It's been about 6 hours since my appointment. I thought I would feel so relieved, so energized, but what I'm feeling is anxiety. I'm feeling overwhelmed. I'm feeling discouraged. I have a list of 8 places I have to make an appointment at or tests I have to order, and I'm gonna do it, but there's a part of me that just wants to stick my head in the sand and keep dealing with my symptoms because it's the evil I know. I feel like I'm walking into a situation I'm really vulnerable in. I'm gonna be spending hundreds and hundreds of dollars and just trusting that there isn't another better way to handle this. I feel so annoyed and resentful that it has taken this long and it's still so hard. And I feel like a burden to myself. I have to spend money that I have saved for other things. I don't want to be a person that has a chronic illness. I didn't expect for a diagnosis to change the way I thought of myself. And on top of that, I couldn't believe this diagnosis took me 22 years to get, when endometriosis is so common. For the people in the back, 1 in 10 people with uteruses have it. And my symptoms were so typical. Now that I know what's wrong with me, what's wrong with a system where someone seeking help couldn't get a pretty obvious and common diagnosis? More on that later. First, I wanted to talk to someone who's been dealing with diagnosed endometriosis for a lot longer than I have.
My name is Emma Maxwell, also known as Endometriosis M on social media. I'm 25 years old. I speak a lot online about my experiences living with chronic illness, especially endometriosis, adenomyosis, Ehlers-Danlos syndrome, MCAS, and there's a long list of other things that I speak about as well to raise awareness and form community.
What you have posted online has been very helpful for me personally, so thank you for being online.
Thank you. I'm so glad.
I asked Emma to walk me through how she got diagnosed with endometriosis.
It took me 7 years to finally get an endometriosis diagnosis, which is sadly on the shorter end of things. My period started very heavy and painful, and it felt like it only progressed month to month. And for a long time, I normalized it. I normalized bleeding through my pants, through a tampon, a pad, within hours at school. And I normalized the pain because I just thought that it's what everybody went through. Things definitely started to progress my senior year of high school into college. I was an assistant manager at a coffee shop. I remember having to sit on the coffee beans in the back, and I would be curled into a ball while customers weren't there. But then people would be like, well, you need to get stuff done. I can't just be sitting back on the beans and look lazy because no one knows what's going on with my body. I remember being in the emergency room and having to leave the emergency room to go to work because no one would cover me. And they were like, well, this is your responsibility. And I was like, yeah, you're right.
That's a choice people should not have to make.
Right, exactly. I, at the time, didn't really know how to advocate for myself.
I think everybody kind of understands the idea of, oh, you have like really bad cramps and it's hard to stand up, or you want to lie down and curl into a ball. But I feel like you are talking about another level of physical disability, basically, because of this pain. Can you talk about just how that would show up more than just, oh, a day of period cramps?
Yeah. I started to experience loss of feeling in my legs. A lot of the times I didn't feel safe to drive. Sometimes getting from my room to the bathroom or getting out of bed or not being able to walk downstairs. I, at this point, was so unwell that when I was on my period, I wasn't able to leave my bed for 4 to 5 days.
Yeah. I think people have an idea in their heads of what illness looks like. And if you went out with your friends on Tuesday and then on Friday, you were like, hey, I can't get out of bed, people may not understand that that's real.
Yeah, that is something that I struggled with a lot just because there is such duality. And now I very much identify with the term being disabled because at the time I think that I was resistant to it because it was like, well, it's not always bad, but it's not what constitutes what a disability is. And my disability is so dynamic that it can be so confusing for people to understand. And that was something that was really hard to get through to people, which is a big reason why I post on social media.
Right.
I did get diagnosed with endo in 2019. I was 20 years old. I, at the time, didn't know the importance of finding an excision specialist. So they used ablation, and it actually caused a lot more pain and issues in the long run.
We need to pause and talk about the 2 different kinds of surgery for endometriosis. And I'm going to let Dr. Orbuch take this one.
If you think of my entire nail as a piece of endometriosis, excision would be removing the whole nail. Ablation would be just burning that white part, like the top of my nail, that little bit. So you're leaving the whole inflammatory lesion behind. Patients often may feel like, oh, I'm better for a month or 3 months. They got rid of maybe a very superficial amount, so maybe it lowered the pain, a drop, but you start feeling pain again. It's the lesion was never removed. So ablation, one ablation begets another, begets another, begets another. Every subsequent surgery is harder than the first. And then it buries the endo more. It poses more risk. And it also raises a patient's pain because every surgery, there's trauma, but every subsequent one actually makes it harder to do a thorough job. And a patient is what we call centrally sensitized. Their central nervous system's on fire more and more with every subsequent surgery. So ablation is the wrong surgery.
Emma says that even now that she knows ablation is, as Dr. Orbuch put it, the wrong surgery, it was still a relief for her at that point.
I got answers. I was finally validated that I wasn't crazy and that there was a lot of endo in my body.
You got out of limbo.
Right. The limbo is so real.
Why do you think that happens so much to so many people? Why do you think it's so hard to just have that next step forward to get the laparoscopic surgery?
Endo affects 1 in 10 people assigned female at birth. It's one of the top 20 most painful conditions in the world, and it has no cure. So why would this not be common knowledge to everyone? And why would this not be something that OBGYNs, doctors would have a deeper understanding of? I don't know.
We're going to take a quick break. And when we come back, Dr. Orbuch will have some answers for us on the big question. Why does it take so long to be diagnosed with endometriosis?
Cause we never really studied the female body.
Welcome back to Cramped. We're talking to Dr. Iris Orbuch, an endometriosis specialist. You mentioned it takes between 7 and 10 years on average to get diagnosed with endometriosis. Why does it take so long?
It's a few different reasons. One, it's that we don't have good imaging to make the diagnosis. I think doctors these days are just like sending patients for ultrasounds, CTs, MRIs. As physicians, we're taught not to use our brain anymore, and we're just taught to like order tests. And then if something shows up on the test, that's exactly what's wrong with the patient, which unfortunately usually is not the case. And if there isn't something, then we tell the patient there's nothing wrong with you, which is so devastating because that's what happens with endo patients. Most of the time, ultrasounds are normal. CT scans are normal. MRIs are normal. Now, we can pick up endometriosis on imaging. It's just the training is so inadequate. So the reason for the delay is 1, imaging is often normal. 2, endometriosis has a variety of symptoms and not everyone has all the symptoms. Painful periods is a huge symptom. And some people dismiss their own period pain because they're asking their mom or their aunt or their sister, is my pain normal? And they're like, no, that I've got the same thing. It's totally normal. But we have to remember there's a hereditary component to endo. If the mom has it, the aunt has it, the sister has it, then that person has a 70 to 100% likelihood of having endo. So we're asking people who are also in pain or dismissing our pain or normalizing it. So that's another big thing. One of the biggest aspects of why endo is so underdiagnosed is the miseducation in residency and medical school. And I often tell my patients that I learned more in my first week of fellowship than I did in 4 years of OBGYN training plus 4 years of medical school. And it is such a shame that the residents who are coming out now and becoming OBGYNs and who we're relying on to go to help us when we're in pain, they're learning the same outdated information I learned 20 years ago. The problem is that OB and GYN are part of one residency, and it's obstetrics, which are delivering babies, and gynecology. And OB/GYN has become a primary care field like family medicine or internal medicine. So I learned more in my residency about how do I manage diabetes in a pregnant person than I did on how to do a good surgery.
After hearing all these reasons, it's amazing endometriosis ever gets diagnosed. I played Dr. Orbuch's explanation for Emma.
I'm sitting here like shaking my head the whole time. It's so disheartening to hear you don't learn things that could help someone, like change someone's life from debilitating pain.
What really strikes me about this is the idea that putting obstetrics and gynecology together all the time really boils women's health and women's health care down to the most important thing is reproductive, is having a baby. That's what OBGYN focuses on. When if someone is pregnant, they're pregnant maybe 9 months, maybe a couple of times, but they have gynecological stuff that needs attending to 100% of the time.
Right.
And this really hit home for me when I learned that endometriosis surgeries are very successful in terms of restoring fertility, because endo is a big cause of infertility in women. And if someone wants to have a child, that surgery is very effective, often in restoring fertility, but not in relieving pain. The success rate for relieving pain is very low. And it sounds like you experienced this too. You had your first surgery was an ablation, which did not help with the pain and made it worse, right?
Yeah, so at first, I felt like I was getting a little bit of relief. With time, I just felt like my symptoms were progressing again. I felt far more pulling, which we now know were adhesions from the first surgery. And things just started ramping back up again. I wasn't getting out of bed. I wasn't really doing much of anything. From learning from the online endo community, I learned so much about like, you need to find an excision specialist. You need to do this, like ask about adenomyosis. I was trying to figure out what was going on with my body because it felt like nobody else in the medical world cared. I wasn't receiving the help that I needed. So I found an endometriosis excision specialist. Going into that surgery, I was convinced that they weren't going to find anything. I was convinced that I was crazy, even though I had the endo diagnosis, because my brain's been rewired to just question every experience that I have. So through that surgery, they found deep infiltrating endo pretty much everywhere where I was feeling it.
Wow.
So I had it in my vagina, in my rectum, on my uterus, pulling up my colon to my ribs and essentially pinning up my colon so that it just couldn't function. And I knew something was wrong because I was so severely constipated and nothing was working.
Right.
But that didn't show up on anything.
Wow. I asked Emma what can sometimes be a very awkward question. But for you, for my crampers, I asked it. How did you pay for it? Did insurance cover the surgeries?
My insurance covered a bit of it,
Yeah.
but there was still a good amount of money that needed to be paid up front. I would not have been able to get my excision surgery if my parents didn't have a means to help me out.
Yeah. It's so wild to me that Emma's story, while harrowing, is a success story when it comes to endometriosis. She got a diagnosis much faster than average, although it still took years. She got surgery to address it. She had the support to afford the care she needed that wasn't completely covered even by the insurance she had. I have a lot of questions, actually, about what's going on with insurance and endometriosis. If 1 in 10 people with uteruses have this incredibly painful condition, but gynecologists aren't learning about it and aren't being trained in the surgery, and none of my many doctors that I saw through my various insurances were able to diagnose me or treat me for it for 22 years. What is going on? Why does it seem like I have to go outside the insurance system to get good care for this, or even have it acknowledged? Considering one appointment with Dr. Orbuch cost me more than 1 month of rent on my 2015 Brooklyn apartment, I asked her why she doesn't take insurance.
The reimbursement from an insurance company is so woefully inadequate. So I don't take insurance anymore, and I can't, because I could be in surgery for 7 hours and insurance company will reimburse me about $660 if I'm lucky, right? Divide that in half for taxes, it's $300. I can't even pay my staff. Forget about turning the lights on, forget about my malpractice, forget about buying gowns in my office. So the insurance companies don't recognize the value of how difficult this surgery is. It's really difficult to do. So a lot of physicians also don't want to go into it because the malpractice is really high because you're operating on people's bowels, bladders, ureters. Like the difficulty and the complexity is so high. The reimbursement is so low. They're not recognizing the complexity of it. So what people don't understand is like, they vilify physicians, but it's the insurance companies who are creating the biggest nightmare. The system is such a mess, and the people who are profiting are the insurance companies by creating these co-pays, co-insurance, co-deductibles that we as physicians have to collect on our end in the office. So we look like the money-hungry people when it's actually the insurance company that's creating a mess. I could rant and rave for 10 hours on this.
We've been wondering over and over again in this series why so many people with period pain end up in diagnosis limbo or hit a dead end. And Dr. Orbuch has some thoughts on how insurance contributes to this limbo so many of us find ourselves in.
You have to understand, the insurance company pays more for an office visit. Let's say they reimburse the doctor $60 for a visit, and that doctor is seeing 8 patients an hour, right? She is giving you 7 to 10 minutes, and then multiply that out in 1 hour, 2 hours, you're making what you would do in the surgery. So OBGYNs are often disincentivized to operate. And then the more tests you send a patient for, the lower grade you get as a doctor in the insurance manual. So doctors are graded with levels. So the more money you spend on a patient, you're not valued by an insurance company. I remember when I used to take a bunch of insurances and I would get a grade, like I'm spending too much per patient. And that's a disincentive. So it's very easy to say, here's a prescription for an ultrasound. Here's a pack of birth control pills. Move on, next one, $60 down, move on. It's a mess on so many levels.
The amount of disincentives and obstacles to getting real answers and treatments for endometriosis is really overwhelming. I was excited to share this with Emma and see what she thought.
I'm at a loss for words. I got the chills and just started to tear up a little bit just hearing that.
Tell me why. What's that reaction about?
I think it's so easy for people to point fingers at the doctors as if you don't take insurance, you are money hungry. It makes so much sense. Insurance is preventing the kind of care that they're wanting to provide for people. Now I look at my surgeon and I'm just like, wow, I wonder how all of that goes on his side too. Because going into the negatives when you're trying to care for your team and the person on the table,
it makes me understand so much more clearly why patients end up in this limbo, why so few doctors get trained in excision, because it's all disincentivized, the way everything is set up. I was curious about these disincentives, and so I did a little more digging. Here's what I found in my research. We know there's 2 kinds of surgery for endometriosis. There's ablation and excision. And excision is the one that vastly improves your quality of life and is the gold standard for care. Ablation is kind of bullshit. That's my non-medical opinion. But the reason ablation is the surgery that happens far more often is that it requires less training. It requires less advanced equipment, and it's a shorter surgery. So there aren't as many disincentives for gynecologists to do that surgery, even though it is not the best care for the patient with endometriosis. And when insurance companies do their billing, there's billing codes. I don't totally understand this process, I'll be honest, but ablation and excision have the same billing code, 58662. You never know when having that number might come in handy. It's just endometriosis surgery. So you can't get more money from insurance for a higher quality, more difficult, longer surgery that is better for the patient because it is categorized exactly the same as a shorter, cheaper, less complicated surgery. And why do these two surgeries have the same billing code? Why aren't they recognized as two different surgeries, one of which is better for the patient? I can only assume that it's because so little research has gone into endometriosis. I looked up the funding for endometriosis research versus the funding for, how about erectile dysfunction? A McKinsey analysis found that between 2019 and 2023, just the last few years, funding for companies that focused on erectile dysfunction was 6 times higher than the funding for companies focused on endometriosis. Erectile dysfunction companies had $1.24 billion in funding, whereas companies that were looking into endometriosis were funded with $44 million. And when we don't pay attention to these conditions, when we don't study them, when we don't fund the study enough, we end up with shitty data. And as we learned with Andrea Jones-Roy, we have shitty data when we as a society just don't care enough to look closer at it. And look, I'm incredibly relieved that I was able to see an endometriosis specialist, someone who had the knowledge to diagnose me and give me my treatment options. But the fact that it cost me $800 and I had to go outside of my insurance to get pretty basic care for a condition that affects 1 in 10 people with uteruses, which, by the way, is almost 17 million people in the US alone. We just can't expect 17 million people who are potentially in severe pain with their period to shell out thousands and thousands of dollars just to get basic care for their condition. Care that could be the difference between being able to show up at work for your family, for your friends, and having to stay in bed because you are in so much pain. Like, am I crazy? Or is that literally what insurance is for? It seems extremely obvious to me at this point that our insurance system is totally broken. And I know this is old news. Somebody just murdered somebody in the street over this, so we know. But what I don't know is what needs to happen to fix this broken system or replace it with a better one. I also don't know how to get better care in the meantime in a way that doesn't involve spending thousands of dollars out of pocket. So instead, I'm just going to ask Emma how she's been doing since her excision surgery and how her pain is now.
I am doing a lot better than I ever thought that I would be after my excision surgery. I'm so grateful that I had my excision surgery. With that being said, I'm still in pain every day. It is just at a lower scale than I was at before. It feels like I'm able to live my life a little bit more. I felt a lot of relief. My periods started to feel like they were a bit more manageable. And I feel like now I'm almost 2 years out from my surgery and things are starting to progress again.
I asked Emma what she uses to help manage the pain.
I have had to create these pain toolboxes and these different ways to take care of my body, learn how to ask for help, and just understand that my body deserves the support that it needs. So what that looks like for me is using mobility aids. I have my stack of canes over here. I have a bunch of different fun ones. It makes it fun being able to accessorize my outfits or like pick one out for the day. And I also use a rollator, like a walker. There are times sometimes when I'm in a wheelchair. Using mobility aids has been something super helpful for me, even getting from my bed to the bathroom or from my bed to go cook myself some food when I'm in a lot of pain with my period or beyond that. I see a naturopath who helps me manage a lot of things. We do acupuncture. I go to pelvic floor physical therapy, which has helped me tremendously. I use different pain relief tools like different topical creams or CBD suppositories. I have a portable heating pad that comes with me everywhere, always. I have multiple, and I will not leave the house without them. I'm currently sitting here with my heating pad on as we record this. THC and CBD are so incredibly helpful for me, which is something that I kind of get blocked from talking about on social media because they take my post down and then say that my account's at risk of being closed. And I'm just like, okay, it's legal.
Right. I love the idea of not resisting the fact that you need support in a bunch of different forms. I think we try to white knuckle it so much. It can be so scary to just like admit that you're in pain, that you need help, that you are not able to do some of the things you would like to do. And that sucks. But once you get there, you can give your body the support it really needs instead of denying it the reality that it's in.
It took me a very long time to acknowledge it. It's not like now I've admitted it and now it's like all fine. There are days where I deny it. There are days where I convince myself that I'm crazy and overdramatic. But I think for the most part, especially the online community has been huge. So life might look a little bit different, but allow yourself the support.
As much as my stubborn and irrationally independent New England heart does not want to admit that I need help and support, I think Emma's right. Part of why getting my diagnosis felt like a letdown and a burden instead of the relief that I expected is that it's forcing me to admit that I need support. Endometriosis doesn't have a cure, so no matter what course of treatment I decide to go with or how much money I spend on it, it's something I'll be dealing with at least until menopause, which is likely around 15 years away from me, which is so crazy that it took 22 years to get a diagnosis and I only have 15-ish years of menstruating left. When I started researching for this podcast, most of my questions were pointed inward. What's happening inside my body? Why does this hurt so much? How can I get relief? Why don't doctors have answers for me? And just like finally getting a diagnosis didn't fix my pain, finally getting answers to some of these questions has only left me with more questions. Like, what happens when so many people get inadequate treatment for their pain? And how does period pain affect someone who doesn't identify as a woman? And what are the economic consequences of all this period pain? Those are the kind of questions we'll start diving into next week. Next week, we are actually going to be talking with my therapist about medical trauma and how it affects our mental health. Maybe she'll be able to explain why getting this diagnosis made me feel so differently than I expected. Cramped is hosted and created by me, Kate Helen Downey. Kelsey DiLanzo is our editorial producer. Sound design and mixing is by Kramarik at Maven Post Media. Our associate producer is Katelyn Sabater. Cramped's incredible theme song is written and performed by Faraday. Our podcast art was created by Nicholas Scheppard. This podcast is supported by the Simons Foundation's Science, Society, and Culture Initiative. Fiscal sponsorship for Cramped is provided by the Arkansas Podcast Collaborative. You can find Emma on Instagram and TikTok at endometriosism. You can find Dr. Iris Orbuch at www.lagyndr.com. Special thanks to Mia Lobel, Yvette Modenow, and Matthew Starr. If you want to join a community of real people talking about their period pain and sharing information, email crampedpodcast@gmail.com to get a link to our Discord. And if you, like me, were intimidated by Discord, don't be. It's basically Slack. If you like this show and find it useful, please leave us a review on Apple Podcasts. This truly helps people find us. And tell fellow crampers about the show. Be the reason one less person is dealing with their pain alone.
What's happening to your body? We don't know because we've never really studied the female body.